Luann should be right up.
Okay, thank you.
Hi, Carrie. Good morning.
Good morning.
Luann.
Good morning. Nice to meet you.
Nice to meet you. We'll come back this way for your new patient appointment.
Okay.
And I understand today you've come to us for a smile design consultation.
Yes.
Okay. Tell me a little bit about what it is that you would like to change with your smile.
The first rule in case acceptance is less is often more. In other words, listen to your patient. If you have a patient coordinator, make sure they know what brought the patient in the first place. Dr. Smallwood's patient coordinator, Luann Sanders.
The best advice that I can give to them is they need to listen to the patient. They need to ask them questions, and they have to be able to give them what the patient is wanting. But they have to listen to the patient as to what they're wanting.
If you have a good patient coordinator, the doctor's job is very minimal at this point.
When I come in, the key with regard to my presentation is to keep it very concise, to the point, and get out. Historically, dentists have a way of spending hours with the patient, talking to them about how much they're going to reduce the tooth, what they're going to do to every single tooth for 25 minutes. There's no point to that. Just get in there, find out what what I call handicaps are, or what their issues are with their smile, and be able to address those. Also address the issues that maybe you can't deal with. For example, if a tooth is very malpositioned, you've got to be able to let them know that I can't fix that tooth perfectly unless, for example, we do orthodontics first, followed by veneers, or whatever your treatment of choice is going to be. You've got to be able to lay out the contraindications and the limitations that you might have as well. So you'll notice with my type of presentation for a 10 veneer case, for example, I'll always have them smile. I can see the wear patterns on their lower teeth, so that tells me immediately whether they have a CO or CR discrepancy, 99% of the time. I'll also, probably 50 or 60% of the time, bring the patient into a treatment room and actually go through all their movements and look at these areas. But for example, Carrie had beautifully positioned lower teeth. I knew that she needed a little bit of help with regard to canine guidance. I'm not going to bore her with that information. There's no reason for me to go into that with her. I will in this situation, in this forum, because of the fact that I could ascertain and basically see within just a few moments how her bite and her function was. And I knew that I, with 10 veneers, could improve her function and improve her aesthetics. That's all she cares about. In fact, Carrie didn't really care about her function so much, but as a dentist, we need to. So I want to be able to provide both of those items successfully. Let me explain the procedure just a little bit. The first, and what we're kind of known for, is what we call the records appointment. Now, have you ever heard of a house being built without a blueprint? No. Well, dentists create smiles every day doing that. It's what they call the prep and pray. They just prep the teeth and pray it all works out. I don't like that. I like to put some time into developing a very sound informational packet so that I can present it to my laboratory so we can create this beautiful smile. That is where our wax up or our prototype comes into play. We will spend some time with you on the next appointment taking some impressions of you. Have you ever had impressions taken?
When I had my braces.
Okay, so you know how it is. Now the good news is it's not 7 minutes anymore. It can be done in about 2 minutes.
Okay.
With regard to the impressions. So we'll take an upper and lower impression. I will take numerous pictures of you at different angles so we can make sure we really capture what you're like our canvas. So I want to be able to create that again with whatever we decide to put on that canvas. Then we're going to measure your bite to make sure, for example, your upper jaw is in relation to your lower jaw very stable. I'm going to look at your eyes and make sure they're straight because I want the very tip of the teeth to match that. So there's all these little aspects that really ensure that we create this beautiful smile. That is what the records appointment is.